Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Lepodisiran, a long-duration small interfering RNA targeting lipoprotein, a background. Elevated lipoprotein A concentrations are associated with atherosclerotic cardiovascular disease. The safety and efficacy of lepodisiran, an extended duration, small interfering RNA targeting hepatic synthesis of lipoprotein A, are unknown. Conclusions. Lepodisiran reduced mean serum concentrations of lipoprotein A from 60 to 180 days after administration. The next article from NICHIM. Identification of hepatic-like A.I.O as a cause of polycythemia. Background. Secondary erythrocytosis often results from conditions that cause tissue hypoxia, or an improper increase in erythropoietin (EPO) production. EPO, the major regulator of erythropoiesis, has a complex and tightly regulated expression during development, with a liver-to-kidney switch shortly after birth. Conclusions. We found that secondary erythrocytosis can be related to variants in EPO that lead to the production of hepatic-like EPO, with an atypical glycosylation pattern and increased activity. The next article from NICHIM. Lentiviral gene therapy for severe leukocyte adhesion deficiency type 1. Background. The beta-2 common integrin subunit CD18 is essential for leukocyte endothelial adhesion and extravasation to inflamed or infected tissue. Damaging variants in ITGB2, which encodes CD18, cause leukocyte adhesion deficiency type I, LAD-I, an inborn error of immunity that leads to frequent life-threatening infections and a high risk of death among affected children. Allogeneic hematopoietic stem cell transplantation, HSCT, represents a curative treatment but is limited by donor availability, a high incidence of graft versus host disease, and graft failure. Conclusions. In this study, lentiviral vector transduced autologous CD34 plus HSCT was successful in treating severe LAD-I. The next article from NICHIM. Mepolizumab to prevent exacerbations of COPD with an eosinophilic phenotype. Background. Mepolizumab is a humanized monoclonal antibody that targets interleukin-5, a cytokine that plays a central role in eosinophilic inflammation, which is present in 20 to 40% of patients with chronic obstructive pulmonary disease, COPD. Conclusions. Treatment with mepolizumab led to a lower annualized rate of moderate or severe exacerbations when added to background triple inhaled therapy among patients with COPD and an eosinophilic phenotype. Next, we will be discussing articles from Journal of American Medical Association. Midurethral Sling versus OnabotulinumtoxinA in females with urinary incontinence. The MUSA randomized clinical trial. Question. Is there a superior procedural-based treatment for females with mixed urinary incontinence who have at least moderate bother from both stress and urgency incontinence? Findings. In this randomized clinical trial of 137 females with mixed urinary incontinence, there was no significant difference between OnabotulinumtoxinA or midurethral sling in the change of the urogenital distress inventory total score from baseline to 6 months after treatment. Both groups experienced improvement, meaning there were no observed differences in outcomes for females with mixed urinary incontinence undergoing treatment with OnabotulinumtoxinA or midurethral sling. The study results support an approach that considers patient preference in partnership with clinician recommendations. Next, we will be discussing articles from Annals of Internal Medicine. Sexual trauma, suicide, and overdose in a national cohort of older veterans. Background. Little is known about the association between military sexual trauma, MST, and risk for suicide-related outcomes later in life. Conclusion. Late life suicide attempt and death by suicide or overdose are associated with prior MST. These findings advance our understanding of the lasting effect of sexual trauma on suicide risk and mortality, and suggest that monitoring and treatment of MST-related conditions are vital over the long term. Next, we will be discussing articles from British Medical Journal. Use of gabapentinoid treatment and the risk of self-harm. Objective: to estimate the effect of gabapentinoid treatment on self-harm conclusions. The association between gabapentinoids and risk of self-harm seems to be multifaceted. An elevated risk of self-harm is present before initiation of gabapentinoid treatment, which persists during the initial phase of the treatment period, and rises again shortly after treatment discontinuation. These findings do not support a direct effect of gabapentinoid treatment on self-harm, but underscore the necessity for close patient monitoring of self-harm throughout the gabapentinoid treatment journey. Next, we will be discussing articles from Lancet. Oral gepotidacin for the treatment of uncomplicated urogenital gonorrhea, EAGLE-1, a Phase 3 randomized, open-label, non-inferiority, multicentre study. Background: gepotidacin, a first-in-class, bactericidal, triazotchinaphthalene antibacterial that inhibits bacterial DNA replication, was shown to be efficacious and well-tolerated in the treatment of uncomplicated urinary tract infections. We evaluated the efficacy and safety of gepotidacin for the treatment of uncomplicated urogenital gonorrhea. Interpretation: gepotidacin demonstrated non-inferiority to ceftriaxone plus azithromycin for urogenital and gonorrhea, with no new safety concerns, offering a novel oral treatment option for uncomplicated urogenital gonorrhea. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Supervised exercise for patients with metastatic breast cancer. Purpose: to evaluate the cost-utility of a 9-month supervised exercise program for patients with metastatic breast cancer, MBC, compared with control, usual care, supplemented with general activity advice, and an activity tracker. Evidence on the cost-effectiveness of exercise for patients with MBC is essential for implementation in clinical practice and is currently lacking conclusion. Exercise for patients with MBC increases quality of life, decreases costs, and is likely to be cost-effective. Group-based supervision is expected to have even higher cost savings. Our positive findings can inform reimbursement of supervised exercise interventions for patients with MBC. Here are the articles from Journal of Hepatology. Metabolic dysfunction-associated steatohepatitis reduces interferon and macrophage liver gene signatures in patients with chronic hepatitis B. Liver gene expression profiles of patients with NIG resemble those of patients with MASH when compared to healthy controls. MASH comorbidity reduces interferon pathway activity and macrophage gene signatures in the livers of patients with NIG. MASH negatively impacts HBV antiviral immune responses, possibly contributing to persistent infection and fibrosis. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Intestinal epithelial serotonin as a novel target for treating disorders of gut-brain interaction and mood. Background and aims. Mood disorders and disorders of gut-brain interaction, DGBI, are highly prevalent, commonly comorbid, and lack fully effective therapies. Although selective serotonin reuptake inhibitors, SSRIs, are first-line pharmacological treatments for these disorders, they may impart adverse effects, including anxiety, anhedonia, dysmotility, and, in children exposed in utero, an increased risk of cognitive, mood, and gastrointestinal disorders. SSRIs act systemically to block the serotonin reuptake transporter and enhance serotonergic signaling in the brain, intestinal epithelium, and enteric neurons. Yet, the compartments that mediate the therapeutic and adverse effects of SSRIs are unknown, as is whether gestational SSRI exposure directly contributes to human DGBI development. Conclusion. These findings provide fundamental insights into how the gastrointestinal tract modulates emotional behaviors, reveal a novel gut-targeted therapeutic approach for mood modulation, and suggest a new link in humans between in utero SSRI exposure and DGBI development. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Salivary beta-2 microglobulin, NOT+, and cortisol levels, and salivary glands uptakes in psiloscintigraphy in Sjogren disease. Objective: for early diagnosis and inquiry into the pathophysiology of Sjogren disease, SJD, salivary secretion and component levels, and salivary glands uptakes in psiloscintigraphy were examined. In this cross-sectional study, conclusions. In patients with suspected SJD, a decreased salivary secretion correlated with a high level of any of beta-2 microglobulin, NOT+, and cortisol. The two of the three levels correlated positively. Psiloscintigraphy showed that the submandibular glands were involved to a greater extent than the parotid glands were. The total salivary gland uptake may be lower than that in thyroid. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. NRF3-mediated mitochondrial superoxide promotes cardiomyocyte apoptosis and impairs cardiac functions by suppressing PIX2. Background: myocardial infarction, MI, elicits mitochondria-reactive oxygen species, ROS, production and cardiomyocyte, CM, apoptosis. NRF3, nuclear factor erythroid 2-related factor 3, has an established role in regulating redox signaling and tissue homeostasis. Here, we aimed to evaluate the role and mechanism of NRF3 in injury-induced pathological cardiac remodeling. NRF3 promotes injury-induced CM apoptosis and deteriorates cardiac functions by increasing mitochondrial ROS production through suppressing PIX2 expression. Targeting the NRF3 PIX2 mitochondrial ROS signal axis may therefore represent a novel therapeutic approach for MI treatment. Here are the articles from Journals of the American College of Cardiology. Nonlinear relation between cardiac mortality and excess temperature in heat waves. Exposure response in 2.39 million patients. Background: short-term exposure to heat waves has been associated with elevated heart disease, HD, mortality. However, the exposure-response relationship curves remain unexplored due to conventional binary heat wave definitions. Objectives: this study aimed to explore exposure-response curves for the associations between heat waves and mortality from various cardiac causes, using excess cumulative temperatures in heat waves, ECT-HW. Here is pulmonary heart disease exhibited the lowest conclusions. The heatwave HD relationships show nonlinear trends with risk thresholds for daytime-only and nighttime-only heat waves, but a near-linear pattern for compound heat waves. Amid global warming, the use of a traditional binary definition could underestimate the mortality risk and burden of HD patients associated with heat waves. These findings highlight the need for disease-specific healthcare measures tailored to different heatwave types to better manage cardiac risks in a warming climate. From JAMA Cardiology. Salt substitution and recurrent stroke and death, a randomized clinical trial. Question: does the use of a reduced sodium added potassium salt substitute versus regular salt decrease the risk of stroke recurrence and death in patients with a history of stroke? Findings: in this pre-specified subgroup analysis of the salt substitute and stroke study (SAS) trial involving 15,249 patients with stroke, the use of a salt substitute led to a 14% reduction in the risk of recurrent stroke and a 12% reduction in mortality, meaning results suggest that salt substitution significantly reduced the risks of stroke recurrence and death, and is a novel and practical therapeutic option for patients with stroke. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Digital voice analysis as a biomarker of acromegaly. Context: There is a considerable diagnostic delay in acromegaly, contributing to increased morbidity. Voice changes due to orofacial and laryngeal changes are common in acromegaly. Objective. Our aim was to explore the use of digital voice analysis as a biomarker for acromegaly using broad acoustic analysis and machine learning. Conclusion. Digital voice analysis can identify patients with acromegaly from short voice recordings with high accuracy. Patients with acromegaly experience more voice disorders than matched controls. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Treatment of acute circulatory failure, based on carbon dioxide oxygen, CO2O2, derived indices. The Lochtel randomized multicenter study. Background. Acute circulatory failure is critical in patients in the ICU. Indices derived from oxygen and CO2 metabolism, CO2O2 derived indices, including the central venous to arterial CO2 difference, and central venous to arterial CO2 difference/arteriovenous oxygen content ratio, are markers for global metabolic demand and tissue hypoxia. Research question. Does a resuscitation strategy using CO2O2 derived indices improve tisular hypoperfusion compared with standard care? Interpretation. Our results indicate that algorithm-based resuscitation using CO2O2 derived indices did not improve lactate clearance or clinical outcomes compared with standard care. Further research is needed to identify specific patient subgroups who may benefit from this approach. Here are the articles from Kidney International Reports. Improving blood pressure in high-risk patients with CKD using an interdisciplinary remote hypertension program. Introduction. Interventions are needed to reduce racial and ethnic disparities in achieving blood pressure, BP, control among patients with chronic kidney disease, CKD. We determined the feasibility and effectiveness of an interdisciplinary remote patient monitoring, RPM, hypertension program in predominantly Black and Hispanic patients with CKD. Conclusion. This RPM hypertension program in patients with CKD was feasible and effective in improving BP, which is promising for increasing equity in hypertension control. Future studies evaluating long-term maintenance of BP control using this approach compared with usual care are needed. Outcomes for patients with a deceased donor kidney offer in the new allocation system. Introduction. In the United States, U.S., disparities in access to kidney transplantation exist for waitlisted candidates with end-stage kidney disease. Meanwhile, changes in kidney allocation policy have been associated with a dramatic increase in the number of organ offers declined before an organ is successfully placed. Conclusion. These findings emphasize the inefficiencies inherent in our current allocation algorithms, and the need to rethink how waitlisted patients are prioritized for a given deceased donor organ, in order to maximize the probability of appropriate utilization of life-saving organs.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.